Now let's look at what's been happening in the rest of the world. There are now over 500,000 recorded coronavirus cases globally. That's the number over there. And the number here, sadly, is the number of deaths, over 23,000. Now, sadly, that number is rising all the time, of course. And we know testing isn't readily available in many places, so the number of cases is likely to be much higher. Now, take a look at this tweet from the United Nations. The language here is really stark. We're at war with the virus and not winning it. And this is an interesting way they've laid this out. It took the world 3 months to reach 100,000 confirmed cases. The next 100,000 cases happened in just 12 days. The third took 4 days. The fourth, just 1.5 days. This war needs a wartime plan to fight it. Well, that was tweeted ahead of a video conference amongst the G20. That's the 20 largest economies in the world, where they pledged $5 trillion to help counter the economic impact of fighting this virus. And, well, here's one example of why that's needed. If we move on to this map, which basically shows us, this was actually released by the European Border Force, shows the status of the border of each country, every one of them restricted or closed. That's having a huge impact on Europe's economy. But the impact of the virus on lives, well, that's massive too, of course. And Spain hit a grim landmark today. Death toll passed 4,000, another 655 deaths in the last 24 hours. Like so many countries, Spain is in lockdown. People ordered to stay at home. And that's now been extended for another 2 weeks. And Spain's Prime Minister, this man, Pedro Sanchez, has been accused of failing to protect healthcare staff by the opposition there, as 14% of those infected are medics. Well, for more, here's Guy Hedgecoe, who's in Madrid.
While the healthcare personnel of the country have been lauded as heroes, a lot of people believe that the healthcare system is rather underfunded in certain areas, and that has been exposed by this crisis. Now, a whole batch of test kits were imported from China for use this week, and it turns out that many of those, or one batch of those, is faulty, or it's not as good as the government had hoped. So there's been a sort of diplomatic issue today between China and Spain over these kits, which the government had hoped would improve testing. So they're having to turn to other imports of test equipment in order to improve that aspect of their management of the crisis.
Well, let's move away from Spain now. We're going to head to Italy. That's the country with the highest death toll in the world. Over 600 people have died in the last 24 hours, over 8,000 people in all. And also to be an error, possibly, in the data collected by the country's Civil Protection Agency, because, take a look at this, it's reported that Piedmont, that region there, had no deaths on Thursday. Now, it's the third worst affected region, so that would be pretty surprising if that turned out to be true. And there are fears that southern Italy could be facing a similar outbreak to that experience in the north. Mark Lowen reports now.
Cities like Bergamo, the epicenter, where they blessed the urns of 113 victims, grouping together the fallen. Wearing a sash of the Italian flag is the mayor, who we reached. With the UK finally emulating the Italian lockdown, a warning.
Britain had an advantage of being 2 weeks behind Italy with the outbreak. They should have used it better. I'm afraid Boris Johnson lost precious time. There's a risk it could cost many lives. Losing those days could turn out to be a serious mistake.
The containment measures may have started to work in northern Italy, although there is again today an increase in new infections. But concern is now growing in the poorer south and here in the capital, where cases and deaths are rising. In Rome, this hospital has opened a new coronavirus wing, and it's already under pressure. The peak hasn't yet been reached here. With crematoria bursting, the army is clearing coffins away. It's that word again they're more used to, war. Man versus virus, and the latter is still winning.
Well, let's move away from Europe now and head south. In Africa, the country with the highest registered number of COVID-19 cases is South Africa, 709. The country is preparing to begin a 21-day nationwide lockdown at midnight tonight. Andrew Harding is in Cape Town.
In those poorer communities today, clear signs of trouble. The message about social distancing has not got through to some.
What can I do? I need my tattoo to be done.
And millions of small businesses like Toomey's Gym fear the government won't help them survive this lockdown.
Nah, they're not helping in financially to support our businesses.
So you're on your own here?
Yeah, we are on our own.
But the immediate challenge here is overcrowding and hygiene. No running water here, and 40 people sharing this toilet.
If I have that virus, then I'm using this toilet, I'm going to affect 39 people.
This is famously the world's most unequal society. The virus looks set to expose that cruel fault line, that chasm between the very rich and the rest, in the harshest possible way.
OK, we are going to leave Africa and head over now to Asia and India, which had a second day of a huge nationwide lockdown. Let's take a look. This was Kolkata in West Bengal. Like many Indian cities now, streets are quiet as the country moves to contain the spread of coronavirus. And police are enforcing strict rules across the country meant to limit the movements of 1.3 billion people. Well, our correspondent, Arunadhay Mukherjee, is in the capital, Delhi. He says there's growing concern over access to essential supplies.
The primary worry among citizens is to get access to essential supplies. Well, the announcement was made by the Prime Minister at the top. Down below on the ground, where the police is implementing those orders, there seems to be some confusion. But in this regard, fresh guidelines are being issued, telling the police who they need to stop and who they need to give free access to. And officials say that in the next few days, at least the supply of essential commodities is likely to be restored. The other big challenge for the government is to address the poor, the homeless and migrant labourers who are stranded without shelters.
Well, I want to take you to one country that appears to have succeeded with the coronavirus where others have failed. That's South Korea. It's managed to flatten the curve of new infections, and it's done it without China's extreme restrictions on movement or a large-scale lockdown. Laura Bicker has been given exclusive access to one of the country's intensive care units in Seoul to find out exactly how.
All of the patients struggling to breathe in this ICU are over 65. They're one of a dwindling number of people who need critical care in the country. The benefits of flattening the curve mean there's even time to smile.
Those who come to the ICU are really bad cases, so it's hard to completely predict whether they will live or not. But when these tough cases get better, it's especially rewarding.
This is the key to saving lives, according to South Korean health officials, staying ahead of the virus by tracing potentially infected patients and testing them. But doctors are worried about a second wave of COVID-19 and say this country needs to be ready.
Can we respond as well as we did in the first wave? Will there be 5, 10 times more patients? I do not know. We don't have immunity. So all countries' scientists should work together to develop a treatment and vaccine.
There's also a new threat from overseas. Thousands of arrivals from Europe and many from the US are now being tested to prevent a fresh outbreak. South Korea may be breathing a sigh of relief for now, but this crisis is far from over.